Welcome back, everybody. My name is Chris Richmond. I'm with ICF, and I am accompanied today by my colleague, Les Warner, and we are fortunate enough to have a number of HUD staff with us again today. We have Bruce Haber, Karen Griego, Flora Chavez, and Barrett Fisher with the Office of Lead Hazard Control and Healthy Homes. So yesterday we did our training of going over elevated blood lead levels for public housing and project-based assistance, and today we're going to do the exercise. So we're going to review the answers to the exercise, and then if you have any questions that you were not able to ask yesterday, you want to go ahead in the Q&A box and ask those questions, and we'll make sure we try to answer those the best of our abilities today. And then if there are no new questions that come in, Les has the questions that were asked yesterday, and he'll verbally review those as well. Just another thing to let you know, on this, depending on how big your screen is, when I scroll down on the exercise, your screen is not going to change. So you need to hover over the gray bar and actually scroll down the screen yourself to see the question. So if you are still stuck on number 3 and I'm talking about number 7, you actually have to physically move your own screen down to do that. So let's get started. First, we have number 1, what document must the grantee and owner have in their files related to the disclosure rule for almost every unit built before 1978? Well, I'm going to go back to the training slides, and we are going to go, and I think it's slide 20. Yep. All right. So slide 20 is where you could go to get these answers if you didn't know off the top of your head. So in your files, you'd want to have the acknowledgement of that pamphlet. So you see the blue pamphlet on the right side. That's to protect your family from lead in your home. It does come in multiple languages, and there is an acknowledgement of receipt of that. So you'd want to have that acknowledgement of receipt that the household received that pamphlet. You'd also want to have a copy of the disclosure notice with the appropriate signature. Remember, this was the proper disclosure notice. And you'd want to have copies if there were any known hazards or if there had been reduction work completed. You'd want to have copies of reports and information about that to accompany the disclosure notice. So that's number 1. Number 2, what does a visual assessment identify, and how can someone be trained as a visual assessor? So going back to our slides, that should be on slide 28, where we talked about visual assessors. And so a visual assessment is going to be identifying deteriorated paint and visible dust. It does not identify if lead-based paint is present. So a visual assessor could be the owner, it could be the owner's staff, it could be the grantee. It's someone who's trained in visual assessment, someone who's taken the free online training that's offered by HUD. We have the link right there. It's easy to access. You can take it anytime. You get a certificate at the end that you can print and have in your file. So again, anyone trained in visual assessment can undertake, can do a visual assessment, and then a visual assessment is only identifying deteriorated paint and dust. We don't actually know if there's lead in that unit or not. Let's look at the next question. We're on number 3. Who is responsible for ensuring completion of the elevated blood lead level response steps, and what is this term called? Let's go back to our slides. And I think it's on 33. Yep. So the term is called designated party, and for public housing, for subpart L, the PHA is a designated party, and for subpart H, project-based assistance, it's the owner is a designated party. And they are the ones that are responsible for carrying out the steps to ensure that the elevated blood level response is compliant. And we do have a number of resources, as you noticed yesterday when we went throughout that training. There's also a designated party handout. Let's see if I can find the handout. Yep. Here's the handout for the designated party, so you can see public housing, project-based assistance, and it lists all the steps and who's responsible for what needs to happen. And then the second page of that is actually a flow chart of what we went through in the training yesterday as well. So if you're trying to figure out what needs to happen, this is just another visual that shows that. All right, let's look at question number 4. How many entities need to be notified when an elevated blood level child is reported? Who are they and what is the timing? Let's go back to our slides. Oops. Slides. And we are going to slide 43. And so 3 entities need to be notified. So we have our local health department. If you were not originally notified by the local health department, then it is the designated party's responsibility to notify the local health department, as well as the local HUD field office and the HUD headquarters. So the Office of Hazard Control and Healthy Homes. And that email is listed there, and that's how you notify at HUD headquarters. So again, this is the Public Housing Authority for PHA. It's the owner for project-based assistance. This is where I often will say the grantee might need to assist the owner in this in case the owner doesn't know how to contact HUD headquarters or the local HUD field office. So even though it's the owner's responsibility, the grantee may need to step in and assist and provide some guidance on where that notification is going to go. HUD recommends using email. You do not include the child's name or the test results. If you are the Public Housing Authority, you're going to include your PHA code and your name. And if it's the owner, it's the owner's name and address, the date of the elevated blood level test, the housing program, is this public housing, is it project-based assistance, the unit address, and if it's in a multi-unit property, the development name, and then also letting them know whether the PHA or the owner has notified the local health department or has been notified by the local health department and the date of that notification. And then this all needs to happen within 5 business days of receiving a verified report or verification. So that was all found on slide 43 for number 4. All right, let's look at question number 5. How do you verify a reported EBLL and what documentation is required? So this is going to be on we're going to start on slide 38. We're going to talk about verification. So a phone call or an email to the medical provider or the health department trying to obtain verification is what can be done. If you have the email and they respond, you'll have a copy of the email. If you do a phone call, just your notes, who you talk to, what their contact information is, the date, that would be sufficient in the file. Sometimes this is the first step you need to take. Others, you need to verify a report. So if you're contacted by the health department, we don't have to do this verification step because it's already been verified. But if the mom calls you and says, my child, I just came back from the doctor, and the doctor says my child has an EBLL, then you need to do verification. If no initial verification is received, you need to keep the records of your attempts, and that's the next slide here. So on slide 39, talked about what do we do if we can't get verification, if no one responds back to us. You do want to try at least 2 times, have documentations of the attempts that you tried to do this, and we want to make sure that you're trying to move as fast as possible, so we don't want to have any unnecessary delays for that. And then, like I said, if you were able to verify, copy of the email or the notes from your phone call with the date, name of the persons that you talked to, and the contact information. So that's all number 5. All right, let's look at question number 6. So what is the primary difference between an environmental investigation and a risk assessment? And who can conduct an environmental investigation? So let's go back to the slides, and we're going to look at slide 45. So an environmental investigation, this is what needs to happen when we have a child with an elevated blood level in our index unit. We need to be doing an environment investigation. And so a risk assessor is the certified personnel who's going to conduct that risk assessment and that environmental investigation of the index unit. And so this environmental investigation is pretty comprehensive. It's more than just looking at the unit where the child is living. They're going to do a family interview. They're going to use the questions from the HUD guidelines. There's a form called 16.1. It's a residential questionnaire for the investigator of a child with EBLL, and so there's a whole list of questions. And so they do that interview in addition to a full risk assessment of the child's dwelling unit. A risk assessment is also conducted of other dwelling units or spaces where the child spends time, such as a child care center, or perhaps they're at a relative's home for a lot of time. A risk assessment might be part of the environmental investigation that those other dwelling areas or places where that child spends time, because we're trying to identify where the source of lead is coming from. So for this environmental investigation, that risk assessor is also looking at other possible exposures of lead, including first flush drinking water. They're going to be looking to see if there's any glazed pottery or tableware that could contain lead glazes. They're going to be looking at work clothes or vehicles that may have been contaminated from a parent or a guardian's workplace. They're also looking to see if there's any imported cosmetics, or perhaps there's a hobby that's being followed in the home where that's causing lead exposure, or maybe folk remedies are being used. So a couple other things I wanted to point out to you. Let's see, on slide 81, this is the link for the family interview. This is what I was talking about, the interview that's being done as part of the environmental investigation, and using that form 16.1 from the guidelines. This video shows the highlights of doing that type of interview. So if you haven't had a chance to see it, we have the link and how you access that there. And then the HUD guidelines that I keep referring to, that's this blue document, the 2012 is still the most current version. We do have the link for you to access that, and it's form 16.1 is where you can find that questionnaire. Again, this is all going to be done by the certified risk assessor, but the environmental investigation can also be done, if you recall from yesterday, by the health department. So the health department, if they have the capacity, they can also take on the environmental investigation as well. All right, so let's go back to our questions. We are going to look at question number 7. If lead hazards are found in the index unit, remember the index unit is where our child with the elevated blood level is residing, do all the other coverage units always need to be inspected? And how soon do they need to be inspected? What type of inspection needs to occur? So let's go back to our slides. And we are going to look at slide 58. Remember we talked about sampling. So if we identify the lead in our index unit, then we have to do a risk assessment of our other coverage units. And our other coverage units are other units that are federally assisted by HUD that have a child under the age of 6 living or expected to live in that unit. Those are our other coverage units. So we need to do a risk assessment of our other coverage units. But we do not have to do a risk assessment of all of the other coverage units if it meets this criteria. So properties built before 1960 and with more than 20 coverage units can do sampling. Properties built between 1960 and 1977 with more than 10 coverage units can do sampling. The sampling guidelines are found in 7.3, and those are found in the HUD guidelines. That's that blue page. Oops, Wrong, let me get to the right slide here, 82. So in the HUD guidelines, table 7.3, so you want to go to chapter 7 and go to table 7-3, and that provides the sampling guidelines. But again, the sampling protocol is going to be put into place by your risk assessor. And then the timing of this, when do we need to do this? Let's go back to slide 64. So the risk assessment of the other coverage units have to be done within 30 days for a property with less than 20 other coverage units, and 60 days for properties with more than 20 other coverage units. And then interim controls, if when we did the risk assessments of our other coverage units, if we identified lead hazards, then interim controls or abatement, if you're in a modernization program for public housing, needs to be done within 30 days for a property with less than 20 other coverage units, and 90 days for a property with more than 20 other coverage units. So that's question number 7. Let's look at question number 8. If there were no lead hazards found in the other coverage units, does a designated party have to do anything else? Let's look at slide 63. So the answer to that is no. So it's no with a little caveat. We still need to provide notification because we did a risk assessment, so we need to provide the results of the risk assessment, but the results will say there are no lead hazards. But then there is no additional responsibility for the other coverage units. We still need to make sure that we are providing lead hazard control for our index unit, but if there were no hazards found in our other coverage units, then we do not need to do any additional responsibility for our other coverage units. But remember, our index unit still needs to follow proper lead hazard control protocols. All right, let's look at question number 9. When is lead hazard reduction work considered complete? Let's go back here, and remember we talked about clearance. So after all of the work has been completed, the unit has to pass clearance. And clearance we talked about, it includes a 2-part visual assessment. We're looking to make sure there's no debris there. This is different than a visual assessment, though. Just the visual is looking to make sure there's no debris, but then there's doing dust sampling and wipes, and those are being sent to a lab. This clearance needs to be done by a risk assessor or a lead inspector if the abatement work was done. If non-abatement work was done, it still needs to be done by a risk assessor, lead inspector, or a clearance technician. So they're looking to see if there's any debris and absence of hazards. They're doing dust sampling. Those are being sent to an accredited lab to check for any lead dust levels. We get a report back. We're interpreting the results of that report from the lab, and then a report is put together, and if it passes clearance, then a notice of lead hazard reduction activities notification is provided, and that identifies where the work was done and what kind of what the results were, and that it passed clearance. So that kind of moves into question number 10, what actions are needed after clearance is completed? And that takes us to slide 72, where we have this notice I was talking about, the notice of lead hazard reduction activities to the residents within 15 calendar days. It goes to those property residents, and then within 10 business days to the local HUD field office. So that's what happens after that initial work is done. Now remember, we did talk early on in the training about ongoing maintenance. So ongoing maintenance is required for project-based assistance subpart H, as well as subpart L for public housing. So for subpart H, if we have less than 5,000 per unit per year, we are doing a visual assessment every year. So the owner can do this visual assessment. They're looking to make sure there's no deteriorated paint. They're documenting that this is being done yearly or unit yearly or at unit turnover, whichever is sooner. And then if for project-based assistant over $5,000 per year and public housing, it's a combination of the visual assessment and then a risk assessment. It just depends on the year. So if we did work the first year, a regular visual assessment can happen. That's done by someone trained as a visual assessor. Then the second year, a risk assessment needs to occur, and that risk assessment is done by a certified risk assessor. If there are no new hazards identified during that risk assessment, then in year 3, a visual assessment can happen. Again, that's just someone trained in that general free online visual assessment training. And then year 4, a risk assessment needs to happen. So again, you have to hire a risk assessor to do that full risk assessment. If we have 2 consecutive times of the risk assessment, so in year 2 and in year 4, and we do not identify any new hazards, then we don't need to continue these risk assessments every 2 years. We can then move on to a schedule of just doing a visual assessment every year to ensure that the unit is not having any deteriorated paint. Okay, I think that answers all of our questions. Les, is there any questions that have come up?
Yeah, actually, while this is on the screen, I think we could deal with that. So there was a related question. Let me flip back to the Q&A that was asking, in reference to this, would those units that were found to have no hazards, would they still fall into the 2-year reevaluation inspection requirement?
What do you mean if they were found to have no, like, they
so
never had any hazards ever, or was there lead work done?
Like our covered units, and we do our environmental investigation, and we determine that they don't have any hazards.
Okay, so this ongoing maintenance is ongoing maintenance as a result of lead hazard reduction activity. So if there was no lead hazard reduction activity that ever took place in the unit, then we don't need to do ongoing maintenance as it results to lead in that particular unit.
Yeah, and I think if we, slide 24 is our summary chart, and where they describe ongoing maintenance, I think does a good job here, where it talks about it being, you know, it's checking where we've had lead hazard reduction work or defective paint in the past, that we're continuing to check about the status of that.
Great. Any other questions as they relate to the exercise?
No, I don't. Well, we had a question about question number 1, and this is related. We've got a number of these. So on question number 1, we talk about things that need to be retained in the file. And so
for disclosure, right?
Yeah. So there was a reference to, you know, all known information, and asking, is this only about the unit or for the building or the site? And separately asked about scattered sites, which we're going to handle in a minute. So my thought, as I was looking at this, was looking again at these summary charts on slide 23 and 24, which are walking through the key steps of, you know, the visual or risk assessment that's being done depending on the requirement. And then based on those findings, we're going to be doing lead hazard reduction activities. So on all of these things that we were doing, we would be capturing and holding on to that documentation. So if our visual assessment or our risk assessment identifies that we have hazards, then we would be doing lead hazard reduction work. We would have the documentation for where those hazards were identified, the work that was done, the clearance information that was attained to be able to complete that project. And then because we have ongoing maintenance and reevaluation requirements, all of that documentation is going to be maintained in that file. It's part of our disclosure, but it also would be, you know, for our ongoing our reevaluation, we're going to need to be able to look back to where the work was done, and be able to then, since we're re-examining those areas, we're going to need all of that paperwork in place.
I think to expand a little bit too, Les, if we're talking about a particular unit, if there was lead found in a common area, and maybe there was no lead in that particular unit, but there was in the common area, and a family is moving into that unit, I think part of that disclosure would say there is known lead in the common area, and this is how we addressed it. I don't know if any of the HUD people want to comment on that or add to that.
Okay. Well, I think we can probably, let's see, so we've handled that. So we had a number of questions that came in not only yesterday but also today on this issue about scattered sites and trying to determine when the sampling that needs to be done, how far we're going with that. So Bruce responded today back on this, which I thought was really helpful. If you turn to Chapter 7 of the HUD guidelines, there's a detailed explanation about this, and it's really based on units that have a common construction. And so, I mean, we're kind of looking at that relationship on a project. So these are scattered sites that have a common construction that's been completed. So I guess first off, look to Chapter 7 for more detailed information on that. And then Bruce had also suggested yesterday that, as you have project-specific questions on this, to use we provided an email linkage to ask future questions that, let's see, yes, right there. So, after you've looked at Chapter 7, as you're dealing with an individual project and you have project-specific questions, we're recommending that you use this linkage to get some project-specific guidance on that. Right. Let's see. So, Chris, if we can go to slide 57. Since you've got controls here. So we had a number of questions that were about this, about the follow-up, the covered units, and trying to kind of identify what was included in the covered units. So remember that our covered units are other units in the property. And so that's kind of the key here. We had a lot of questions yesterday where people were talking about, well, if we have multiple buildings, are we just talking that building? We're looking at the property itself, and that's kind of how we got into the scattered site question, which we're then referring you to Chapter 7 on. So it's all of the buildings in the property that are going to be part of this determining if we have other covered units. And when we talked about how we define covered units, that's other units that have federal assistance and they have a child under the age of 6 that's occupying that unit. So mentioned yesterday that that might not be your particular funding source that's the federal assistance, so there could be other funding sources in that same property that are triggering the meeting that definition of covered units. And that would include if you had units that were specified or set aside for the elderly or disabled, but had current occupancy of children that were under the age of 6. Because those are assisted units, and in those cases where they have a child under the age of 6, they would be included in that, identifying all of the covered units that were part of that. And then, Chris, if you can flip to slide 58, the next slide. So there were some questions about sampling. And so, the guidance here we talked about, which kind of helps when you have larger numbers of units trying to get that completed, that being able to establish a representative sample instead of needing to sample each and every unit. So we've got two categories of criteria on this. One is for properties that were built before 1960, and then the second category is properties that were built between 1960 and 1977. So this references in Chapter 7 in the same guidance where we were referring you to about scattered sites. There is a table at the end of that chapter that, based on the number of units, then there is, and then for each of these categories, the pre-1960 or the 1960 to 1977, based on the number of units, then there is a designated number that would need to be included in that sample. So that's going to be your guidance on determining how do I determine my sample size. So for instance, if I had a property that had 52 or 53 units, then we would be, if it was a pre-1960 building, we'd be looking at 33 of those units would be our required sample size. If it was a building developed between 1960 and 1977, our required sample size on this is 22. So there's very specific guidance included in Table 7-3 within the HUD guidelines, which we would refer to you on that.
Yeah, and just remember that your risk assessor is going to be designing that sampling protocol, but you can check back at that on the HUD guidelines to make sure that they're following what needs to be followed.
Exactly. And then, Chris, if we can go to slide 34. So we had a number of questions that came in yesterday, and I just want to revisit this for a moment. So we mentioned the fact that there were some changes in 2017 which changed the definition for elevated blood lead level, bringing it down to 5 micrograms per deciliter as our threshold on that, and putting that in line with the CDC. We mentioned then that the CDC has changed. Now, the CDC's terminology is blood lead reference value, and so essentially this amendment put the mechanism in place, or allowed HUD to be able to amend this, but keep in mind that the CDC's designation is based strictly on data, and that HUD would have some additional steps that they would need to go through to be. So it's not an automatic, as soon as CDC changes something, that it automatically will be lowered based on that reference value. So there is a possibility that in the future that this could be amended, but it's not an automatic thing that becomes effective at the point that the CDC makes a change to their reference value. Chris, I think that's actually that's the questions from yesterday that we have to review. So,
okay, we did get confirmation about what we needed to share with a unit. So somebody was asking if there was lead found in Unit A, do I have to tell the renters in Unit B? And the answer was, well, assuming you're asking what needs to be disclosed, unrelated to eligibility levels, which is the regular general disclosure rule, the public housing authority, the owner, must disclose known lead-based paint information for the particular unit that household's moving into and the common areas prior to the lease execution or when any new lead-based paint information becomes available. So that confirms what we were talking about earlier.
And I want to highlight, since I don't know if folks are trying to follow both what's happening in the Q&A. There also was a question about if we had project-based voucher tenant that's not cooperative, and they're not confirming the EBLL report, asking about what the PHA or owner can do on this. So keep in mind that, as Bruce answered here, that if that initial report that you have received is coming from the health department or a medical provider, then you have confirmation of the EBLL in place. That means that you need to proceed with the required steps, having an environmental investigation completed for that unit. We also talked about that, if we're unable, we would immediately make multiple attempts to try to get confirmation when we had an elevated blood level or reporting of that, and that you would want your files to be able to reflect that you made every attempt in a timely manner to be able to get that confirmation. Let's see. I think we've covered the other one that was here, so I think that covers everything that's come through.
Yeah, I don't see any other questions that have come in yet either, so we can hang out for a minute or two, see if any new questions come in. We did mention that there's going to be additional training, same training as what we did in the fall for Subpart L, public housing, and for Subpart H, project-based assistance in February. So if you did not attend that, registration should be coming out soon about those 2 training sessions. Okay, someone's asking about yesterday and the duplicate EBLL for the same child. I'm not sure what they are asking
about. And I think actually, I think that's a question that when it came through to us, it cut off. We only got the front part of the question, so not enough to be able to answer. So maybe this person can provide a little more information on this, and we can try to deal with that.
Yeah, Chris, Les, this is Bruce. There are, actually it's fairly common. Now, once a kid's been identified with an elevated blood level, there is follow-up medical examinations. And so there will be times when you will get another report for the same family, same child, same unit. If you've done the risk assessments from the time it was first done, and you wouldn't have to do another thing, you should check in with the family for sure. Is the blood lead level dropping? If for some reason the blood lead level has gone up, then the environmental investigation may not have identified all the potential sources, and so it might be advisable to come back and do it again. This would also be a time that you'd really want to coordinate with the health department. On the other hand, if you have the blood lead levels falling, then you know that what you've been doing is on the right track. It doesn't mean you don't have to do anything. I do recommend that you go back in and talk to the family again and make sure that they're doing what they want to do, because the blood lead levels don't drop back to zero immediately. It may take a while, particularly if there's other sources because of where the child goes throughout the days that are not related to the unit. It is a touchy thing, but you don't have to start the whole process all over again. It is advisable that you do report the EBL to lead regulations as well as to your HUD program office, and that you're tracking conditions and the health of the family. So the goal is to get it all the way down to zero. Some kids go in for multiple tests. Some kids never get tested again.
Yeah, I think, Bruce, that completely answers what this person was trying to ask, where they were saying they had gotten a notice and then 6 months later they got another notice, but the level amount had gone down. So hopefully that guidance you provide, yes, the person said thank you. That's helpful to them.
Good.
Great. Yeah, thanks for sending that in again. I don't think we quite understood what the question meant yesterday, so thank you for resubmitting that this afternoon. Any other questions? Well, maybe I'll just show the page again. Was it 81? Just our videos again. This one is highlighting the family interview, but there is a risk assessment highlight video. There's a lead inspection highlight video. There's a clearance highlight video, and then there's also a reports highlight video. So if we do any type of evaluation, like a risk assessment, we're going to need to do a notice of evaluation. And if we do, so that's a report. We're going to have reports for risk assessment. There'll be a risk assessment report. There'll be a lead inspection report. There's clearance report. So that reports video that you can get to from the same link here will also provide you with information of what needs to be in those reports. Someone's asking if the unit was built after 1978, does the landlord still have to provide the disclosure in the pamphlet? The answer to that is no. Remember, it's exempt from the lead safe housing rule if it was built after 1978. So we are only dealing with properties that were built before 1978, because after 1978, lead was banned in residential paint. Great. Les, do you have anything else to add? I guess we can give people back a little more time for their afternoon.
I don't.
All right. Well, thank you, everybody. Thanks for participating today, and thank you for our HUD staff for helping to support us. And hopefully we will see you in another future training. Have a great afternoon. Bye, everybody.
Thanks, everybody. Bye.